Well, good morning, everyone. How are you? Once again, welcome to another live this morning. Hope you're having a great start to your day. And we appreciate you guys when you can come on. As you get your notifications here, I'm just waiting here. Let's see when it gets started. Hello. Here we go. Starting to come. Okay. Just looking at a question here. Okay, guys. There we go. Okay, let me just see if I'm on here so I can see you guys. I think I should be. And here we go. Yep, there we go. Okay, took my sound down. Okay, Brahim, Rain Cloud. Okay, you are number one on my hit parade this morning. Natalie, how are you? Brahim, you're at the top. Rosa, because Brahim always says I miss him. Fran from Orangeville. Rosa's from Montreal. Deb, how are you? Madeleine, Kippawa, Quebec. Lise, how are you? Linda, we all love the Lindas from Nova Scotia. Excuse me, from New Brunswick. Nick from our staff. Sandy, Chilliwack, British Columbia. Hello, Janine. Joyce, Diane, John from Elgin, Illinois, Mary, and Natalie, and Nativity, and Georgie, and Frida, Mary, Cheryl, West Virginia, David from Ridgeway. There she is. Doc McEwen, our dear friend from West Tennessee. I finally see, Doc, your name. Okay. Rose, how is you? April, Francis, and Milika from Stouffville. Helga, how are you? Donna from Park Hill. Darlene, good morning. Karen, good morning. Dan, how are you? Linda, St. Jude, Quebec. Germaine, Rosalinda from the Kidneys of Canada, Niagara Falls. Debbie, Patricia from Pulaski, Tennessee. Well, how are you, Patricia? We love having you on. Danny Lay from Iron Bridge. Dave, Nancy, Marl is from Ottawa. Patricia, a lot of Patricias. Wanda from Virginia. Crystal, how are you? Catherine. Kristen from Saskatchewan. Couple of more. Dorothy, P.E.I. Melanie from Vulcan, Alberta. Where's that? Where's Vulcan, Alberta? Cheryl. Kerry, Nebraska. Dave, Anna, Cecilia. Hey guys, thanks for coming on. Hi Joanna, we love you. Thanks for coming on. We appreciate it. Hi Lise, how is you? Okay, that was the roll call, and I guarantee I missed some people, but anyway, I love you guys. Thank you, and we appreciate you. Okay, I want to get back to yesterday's proton pump inhibitors, okay? PPI, we'll get back to that. Let me give you another thing here that just came out. I saw it this morning online from the Sudbury Star. And it said this, okay? I just want to comment on this because you and I have talked about this in the past. 153,000 people were harmed last year. So very recent 2024 statistics in hospitals, okay? 153,000 people were harmed in the hospital. Now listen, let's put a disclaimer on it first before I get people getting upset, okay? First of all, I didn't make up that statistic. It comes from a study that looks at all these things. And look, I've always said this. If you followed me for any length of time, I've said this. The most dangerous place in the world is not Afghanistan. It's not in Gaza. The most dangerous place in the world is your hospital. Now, listen, if you gotta go to the hospital, you gotta go. So we're not saying that at all. Okay? So don't misinterpret what I'm saying is that the statistics are bearing this out, that it's a lot of bad things a lot of good things happen in a hospital. You get hit by a truck, you want to go to the hospital. Okay? Guys, all I'm saying is that what happens after admission to the hospital sometimes ain't great. And a lot of it is human error. Okay? And that's what they're saying. Drug errors. You know, you play with drugs. And I don't mean on the street. There can be major side effects to that. That's what this is saying. Hospital, this is the big one that I talk about the most. Hospital-acquired infections like C. difficile. I mentioned this yesterday because one of the things that protect you from C. difficile, hospital-acquired bacterial infection that often kills you. If you're in the hospital, think about this for a minute. You're already there. Well, generally speaking, you're not in good shape. Either from an accident or you already have an infection, you already have sepsis, or you're very unwell. I know one thing in Canada, you're not in the hospital for nothing. Okay? That I guarantee you. You're already unwell, your immune system's already compromised, and then you go into a place where you have antibiotic resistant infections like C. difficile. And C. difficile came about, well, I talked about this 25 years ago, guys. There's a couple of reasons that it's so difficult. C, okay? Difficile, French. Difficult to treat. Why? Because it's resistant to antibiotics. Why did it get a resistance to antibiotics? The overuse of antibiotics. The same thing that saves your life can kill you. Antibiotics. Wonderful. Except when you overuse them, bacteria have an innate ability to protect themselves. And what happens? They develop resistance to an antibiotic. Guys, this is such a big problem. It's a lot bigger problem than we think it is. Because most people, well, look, I mean, it's better. I have an infection. I better get on an antibiotic. Well, maybe if it's raging. You know what bothered me probably almost more than any other use of antibiotics is dentists using antibiotics. I don't know how many times, I don't think they do it as much today. Correct me if I'm wrong. You better take an antibiotic because I need to do dental work. So start taking it before you come and see me. Are you kidding? I used to get a migraine talking about it. Like, that's craziness. But it was like candy. And I kept screaming like John the Baptist in the wilderness, don't do that. Why? Because antibiotics will cease to work. They'll stop working. They'll stop being effective. And that's a big problem in hospitals. One, okay? Antibiotic overuse. Not only in the hospitals, but when you get to the hospital, where does C. difficile hang out? At the hospital. And people with already a compromised immune system, they're sitting ducks for reinfection. Sitting ducks for it. So that's, and then I'm going to give you another one. And this might bother some people, but I think I'm right about this. We over clean. And I don't mean with soap and water, okay? I don't mean that. With all these antibacterial, like if you want to go to a place where they use antibacterial soaps and antibacterial cleansers and antibacterial chemicals, the number one place is in the hospital. And I understand their thinking. They're trying to wipe away all the germs. But what they don't realize, again, is they're creating superbugs. They're using all these harsh chemicals. And this is why I talk against that in your homes. And people, listen, I love cleaning. I do. Ask anybody. I like cleaning, okay? I can't do much, but I like cleaning. But I'm really careful of what kind of stuff I use. Okay, as much as possible. Like I like vinegar because it doesn't create superbugs. Bacteria doesn't develop a resistance to it. I'm just telling you, when 153,000, this is conservative, people are getting all these issues in hospitals. It's making the news. In my radio show days, I had that statement. The most dangerous place in the world for you to visit is, and I used to use in my radio show days, Afghanistan. Okay? Because people, Afghanistan, I wouldn't want to go there. I mean, it's a war zone. Yeah, but so is your hospital. It's a war zone. Anyway, don't shoot the messenger. I'm just bringing this out. And I'm not telling anybody not to go to the hospital. Of course I'm not telling you that. But, and what they should be doing in the hospital, what they should be doing, they don't do it, they should do it. Everybody and their dog in the hospital should be on probiotics. They should be just handing them out like candy. Because if your microbiome is not compromised, wow, does that make a big difference when it comes to your immune system. Have I not been talking about probiotics for, it seems like a century? So I always tell people, look, they'll probably tell you to get off all your supplements. You're going in for surgery. I said, don't listen. Don't listen to that. I got to be careful because I'm going against the grain. I know that. They don't want, you can't, you're going on surgery, I don't want you on any supplements. Ooh. Instant migraine. You're going in for surgery? Triple up your probiotics. Please. You're going in for surgery. You need to protect your microbiome. Regenerate, replenish. Regenerate, replenish. Renew your microbiome. You want to help yourself? Don't tell anyone. Don't tell them. How do they know if you're taking a probiotic? You think they're there counting bacteria? They're on your side. Don't ever go into surgery. If I go visit in the hospital, I make sure I'm taking more probiotics. And vitamin D. The sun. And when the sun ain't out, take your vitamin D, please. Please. Vitamin D, it does so much for your immune system, your natural immunity, natural protection. And I tell you, make sure you're not taking your supplements. They should have you lined up with supplements in the hospital. Everybody in the hospital, everybody should be getting a B12 shot. And they should be injecting vitamin D into patients in the hospital. They'd be shocked how much better people do, how much better they recover from surgery, and how it protects them from C. difficile. Do you think people will ever listen? Linda? Do you think it'll ever come to where they listen to us? I'm not holding my breath. I'm not. But I know I'm right. Take care of your immune system. Take care of your microbiome, which is a big part of it. You got bacteria from your brain to your toes. And you need that. Anywho, 150, this is Canada, 153,000 people in 2024 were harmed in the hospital last year. Yeah, okay. Do what you can for your loved ones if they'll listen. It's amazing how doctors, I'm very negative when it comes to this. It's amazing to me how the medical profession, who don't study supplements for 5 seconds, tell you not to take a supplement just in case it would, I've had oncologists. Well, you're taking chemotherapy and radiation, and you need to get in case your supplements might interfere with that. Guys, it takes my breath away. Takes my breath away. The silliness of that. The silliness of that. Pump up your immune system. Please. Anyway. Okay. That was a little rant. I didn't think I'd be on that one as much. I just got going. I couldn't help myself. When I see a statistic, came out this morning. I just read it. And I hate to say, I told you so. I usually don't do that with people. I told you so. I've been preaching this for so long. I told you so. The most dangerous place in the world. Your local hospital. And God loved them. Okay? They do a lot of good. I know that. I'm not one of these people, guys. I think you know that. I'm not one of these people that, dismisses all of medicine. I don't do that. Okay? I don't dismiss the use of antibiotics. Never have, never will. I don't dismiss that. In my practice days, I don't know, 1,000 times a year, I'd say, well, I mean it. You need an antibiotic. What? You need to get on an antibiotic. I saw in my office, I can remember, specifically, people come in. You got cellulitis there, man. You need to get on an antibiotic and quickly. But I always had a balance to it. So, for example, I did urine testing in my office. So you came in, and oftentimes in women, you got a UTI. You have a urinary tract infection. But, okay, a lot of them were shocked. They didn't know. I said, well, you didn't know about it, right? No. Well, your leukocytes are up, your white blood cells in your urine. They're up, okay? You got, and a lot of times, blood in the urine. And I said, well, I don't reckon, could then right away they go, well, doc, should I get on an antibiotic? Well, no, of course not. There's no need for it. You don't feel it. If I didn't do a urine test, you wouldn't even know you had it, right? Oh, I didn't know. Okay. Well, then you don't want to treat it with an antibiotic. You don't need an antibiotic. That'll make it worse because now you're going to kill your friendly bacteria and you're going to start a process of an invasion of the third species, the Trojan horse. You're going to start with a yeast infection. You don't want that. You don't want the Trojan horse coming in. So here's what you do. Double up your probiotics. I want you to do it for a couple of weeks. Double them up. Flush it out. Lots of water. Flush those kidneys. Flush that bladder. You don't need an antibiotic for that. And a lot of times I get a call. Okay? Wasn't even in my office, just one of my patients. Doc, I got a urinary tract infection. Okay? How do you know? Oh, it's burning. Every time I go to the bathroom, it's really burning. It's very uncomfortable. Okay, well now you need an antibiotic. But I used to tell them, okay, my patients, take an antibiotic until the burning stops, and then stop taking it. That's the new research on antibiotics. What? Well, my doctor said, take them. I given you 7 days, take 7 days. I don't agree with that, and the research doesn't agree with that. That's old-time thinking. Because they always worried, here's like, I've talked to 1,000 pharmacists about this. Well, the worry is, you really didn't kill all the infection. Because my dear friendly pharmacists, what they never learned in school was the microbiome. They didn't even know it exists. And I used to try and explain it. Well, listen, you're going to set up, with the antibiotic, you're setting up a dysbiosis. What's that? Well, that is where you have more bad guys than good guys. Antibiotics, lovely when you need them. And you don't want to take, okay, listen, I'm not giving medical advice for individuals, okay? Please get this, okay? I'm not in practice anymore. I'm giving you my take. I'm giving you what I used to tell my patients. Take the antibiotic until your symptoms go away. And then double up, triple up. I had patients taking 10, 12 probiotics a day for a few days. Okay? One a day is fine. But when you got an infection, I used to recommend they up that. And it's amazing how that kills any risk of getting a fungus, a yeast developing. Because that, guys, is one of the biggest problems that happen in the hospital. They don't see it because they don't test for it. A lot of those infections, bacteria, yes, are there, but it's the underlying current of that infection it's fungal. And antibiotics make it worse. And that's another side effect. Not only do you get resistant bacteria, they develop a coating, resistant to the bacteria, but then you get a fungal infection. And, you know, fungus, I hate to be negative. It could hit a doctor in the face. And they don't study fungi. They don't. Well, you guys have heard this. This is not going to be new to my audience. What are they saying is one of the major causes of cancer? Well, the new thing out, the new kid on the block is now they're talking parasites. But what I've been talking about for the last 40 years is fungus, yeast. And an antifungal, they're talking about that now. An antiparasitic, antifungal. You know, they're talking about how great that is in the treatment of cancer. Have you read anything about that or looked at that on the internet? Guys, okay? You know, some doctors are saying parasites. I say it's fungal, okay? Like just from my experience, okay? I'm not dismissing parasites. I'm not. But I'll tell you why I don't think it's parasites. Okay? I think I mentioned this before. Because if you have an animal in your house, you got parasites. Okay? You have parasites. You got a cat, it licks you, you got parasites. You got a dog. I see people almost French kissing their dogs. They love them so much. You have parasites. So if parasites cause cancer, well, I then you got to get rid of your pet. Are you going to do that? No, you won't do that. And I don't want you to do it. It's fungal. That I am convinced of. Now, is parasites have anything to do with it? Maybe. But I'm not convinced. Okay? Not that I don't read. I'll read I read everything that I can get my hands on. But I'm not convinced. I think it's yeast. I've said this for 40 years, close to it. It's fungal. And that's what happens in the hospital big time because, again, of the overuse of antibiotics and the antiseptics, the all the chemicals. Believe me, I always laugh at the hospital in a way, okay? And I'm on hospitals today. I no use me getting off of it. I'm almost done. You know when they tell you this is a fragrance-free zone? I get the triple migraine when I read there's signs there. It's a fragrance-free zone. And they got a gazillion chemicals that they're cleaning with, including the antibacterial soaps that are at every 5 seconds when you're walking around in a hospital. And this is a fragrance-free zone? I didn't think I was going to... Guys, I didn't think I was going to get off on a tangent like I was today. I really didn't. I was coming back to my proton pump inhibitors, but we'll do that next week. Because tomorrow's Q&A. Tomorrow's Q&A. So send in your questions to info@martinclinic.com. info@martinclinic.com. The Q&A. Okay? Okay, I breathe. I'm breathing. I get all uptight. No, I'm very opinionated. I admit it. But I think I'm right about this. Anyway, okay? You got to go to the hospital, even to visit. Make sure your microbiome and your vitamin D, those two things especially, are up to snuff. Okay? We love you. We'll talk to you soon.